So now an aneurysm can occur in the aorta when there's a weakness in the wall. What happens is that the constant pressure of blood pumping through can cause a balloon-like bulge to develop in the weak area. And the force of this blood can also cause the aneurysm to rupture or split. When they rupture, the aneurysm bursts completely and it causes life-threatening internal bleeding. As for the medical term hemopericardium, this refers to blood in the sac that surrounds the heart, Brian.
Okay, so Wall reportedly did not feel well, experienced chest pressure shortly before his death. So would that have been a warning sign? And what are the symptoms? Can this thing be avoided?
Yeah, these are important questions, right? So aneurysms often do not cause symptoms. That's the problem. That is until they become large or burst, like what unfortunately happened to Grant. Now, here's some signs to look out for. Shortness of breath, pain in your neck, back, or chest, painful or difficulty swallowing, coughing, a weak, scratchy voice, or hoarseness. Now, if an aneurysm does rupture, symptoms will often come on very fast. They include sudden and severe pain in the chest, back, or abdomen, dizziness, or lightheadedness, kind of a fast or rapid heartbeat. The best chance of survival is getting medical care immediately, and surgery can effectively treat a ruptured aortic aneurysm if it happens quickly. Now, what about prevention, right? As for preventing aortic aneurysm, please know that high blood pressure, high cholesterol, or smoking increases a person's risk. According to the CDC, in 2019, roughly 59% of deaths due to aortic aneurysms or aortic dissection happen amongst men. So, if you're thinking you're at high risk for developing aortic aneurysm or
some aneurysms are very risky to a patient. They affect about 1 to 2% of the population. Only a small proportion of those patients will go on to have a rupture. And the challenge with rupture is that it's unpredictable. So the typical presentation is somebody who has the worst headache of their life. They come to the ER, and that event could be a final event. It could be a fatal event. But it is a very challenging situation when an aneurysm ruptures. An aneurysm can cause one type of stroke, which is subarachnoid hemorrhage, and intracerebral hemorrhage, which is bleeding into the brain and into the layer that lines the brain. Bleeding into the brain is a very serious problem. It is very important to make the diagnosis when somebody has an aneurysm, and that requires what we call detective work by the emergency room physicians and team, and along with the neurology and neurosurgery team to make the right diagnosis. An aneurysm can give a warning sign, so patients can have what we call a sentinel headache or a warning headache that may imply that a bigger headache or a bigger rupture is coming. So about 20% of patients who rupture an aneurysm in a big way have a warning headache a week or 2 weeks before. And it's very important for a patient to seek medical opinion when that happens, and it's very important for the medical team to make the diagnosis when that happens. Aneurysms can also press on adjacent brain tissue and cause double vision or other symptoms of pressure. Aneurysms can also leak into the surrounding brain tissue, and that can cause seizures. So a seizure can be related to an aneurysm. Rarely, an aneurysm can also form clot within it, and that clot can travel downstream and cause an ischemic stroke. Or if you come from a family with aneurysms, smoking is a very bad idea, because smoking is a risk to any person in terms of developing an aneurysm and rupturing an aneurysm. But if you have a genetic family history of aneurysms, your risk is probably 4 to 8-fold higher. In patients with polycystic kidney disease, particularly if there's a family history of aneurysms, so if you have a family history of both, your risk of having an aneurysm could be as high as 30%. We are now living in a time that is very exciting in terms of what we can do for patients with aneurysms. We have the traditional open surgical approaches, which have benefited from an evolution towards less invasive approaches, some of which we've designed here at Mayo Clinic. The technology we have today to navigate in a minimally invasive way into the brain and open up a closed brain vessel has never been better. We now have devices that are designed to open up brain vessels where we can achieve a great result within 30 minutes of putting the patient on the table and doing the procedure. We also have many techniques now where we don't need to make an incision, and we can go through a groin artery and tunnel up a catheter into the brain, and through a small catheter seal an aneurysm from the inside with coils or with a stent or a combination of coils and stents.
Reaching out for help to save my beloved mother. She urgently needs brain surgery for an aneurysm. I can't bear the thought of losing her. She's my only family left after so much loss. Your support can make a significant difference in their recovery. Please consider helping us during this critical time.